behalf of Dean Cole, we would like to welcome you to today's pinning ceremony. As part of the School of Public Health tradition, this year's annual welcome ceremony was held on October 5th from 2 to 4 p.m. Pacific Coast time and 5 to 7 East Coast time in Philadelphia. We here in Sacramento will hold our ceremony today. The ceremony is an opportunity to welcome students to the school. Today's event includes a pinning ceremony that was first instituted by Dr. Jonathan Mann, the founding dean of the school. Students recite the preamble of the Universal Declaration of Human Rights. This year's ceremony, keynote speaker in Philadelphia was Drexel's president, John Fry. For our ceremony, the keynote speaker is Dr. Mark Horton, former director of the California Department of Public Health. At this time, I would like to introduce the dean of our school, Dr. Marla Gold.
This Warren and I being very cozy together. So, greetings to everybody. It's really great to see everyone. I look forward to meeting everybody not only on real time but in person. And who am I seeing? Seth, my eyes. So greetings to everyone. You heard on the annual food ceremony that John Fry was here. I was thinking, and Mark, I see you back there, that you're actually for the tree of real public health. Love our president, but when it comes to the inspiration about public health practice, the pathway to get there, everything that's possible, I think you have one of the top experts in the nation, and certainly in the region, right in the room. The city getting ready to be inspiring. As you heard from Ray, it's akin to what is known as the white coat ceremony for physicians, where the students all boots, how to work, how to version. We really talk about what it means to enter the world of medicine. Consider this really, I've been doing it for a while, but it's a tool. So we'd like to make sure that we have a speaker and get a chance to talk about it and have the pinning ceremony. If you haven't done so, also, when you have time, a lot of what we've done on the East Coast, these podcasts that are made available as much as we can for you. We're aware of the time difference, and also, importantly, that we're professionals and this is tight. So, in sum, I want to thank you for being here. I want to thank you for choosing Drexel, and also either welcome you to furthering your world in public health, since this is the executive program, or for joining us in the broad world of public health. It's a wonderful, wonderful place to do the kind of work, whether it be in government, pharma, industry, whether you're furthering what you're doing currently, or adding something new to the agenda, and finally doing something that you have a passion for. We're glad that you're with us. You want to add, sir?
No, I just like to say welcome and glad to see all of you that I've met in the recruiting process here. And we'll turn it back over to Professor Long.
All right. And we'll be car talk in the background, Mark, so, don't get worried.
Okay, so I'd like to do this time give a brief bio of Dr. Mark Horton. Dr. Mark Horton is a physician and public health official with over 15 years experience directing state and local public health agencies and 18 years in clinical practice in pediatrics. He has been a leader within the public health community, both regionally and nationally, and have served on the executive committees of California Conference of Local Health Officials, the National Association of County and City Health Officials, the Association of State and Territorial Health Officials. Dr. Horton was appointed by California's Governor Arnold Schwarzenegger to the position of State Public Health Officer in 2005. From 2005 through 2007, he served as a State Public Health Officer and Chief Deputy of Public Health Programs for California Department of Health and Health Services. In 2007, he was appointed the first director of the newly created California Department of Public Health and served in that capacity into early 2011. During the time, he advised the governor and secretary of the California Health and Human Service Agency on public health issues. As director, Dr. Horton maternal and child health and health care quality and public health preparedness for all California. Dr. Horton also served as deputy agency director of public health programs and health officer for the county of Orange Health Care Agency, vice president for community programs at San Diego Children's Hospital and Health Center, and state public health officer and director of health for the state of Nebraska. Dr. Horton received his medical doctorate from St. Louis University Medical School and his master's of science in public health from the University of North Carolina School of Public Health. He is a diplomat of the American Board of Pediatrics and a fellow of the American Academy of Pediatrics. At this time, I'd like to welcome Dr. Mark Horton.
Thanks, Dr. Lum. And thanks to both of you for being here also. Good to see both of you. Well, good afternoon. It's really an honor for me to be here to add my words of welcome to all of you as you begin your career and your journey in public health. You've chosen an outstanding and challenging field of endeavor, an outstanding academic center of Drexel University and its School of Public Health, and a robust and challenging community of Sacramento and Northern California. Welcome. After spending half my career in clinical medicine and half in organized governmental public health, I am more convinced than ever in the critical importance of public health in shaping a healthier future for all of our citizens, our country, and our world. You've chosen the right area. We are a wealthy nation with the largest and strongest economy in the world. We are the strongest nation in the terms of military standpoint. But we are far from the healthiest nation. Despite having access to the most sophisticated and most expensive medical technology and spending more on medical care per person than any other nation on earth by far, we lag far behind many other developed countries in basic measures of population health. I'm sure you know the numbers already. Teen pregnancy, infant and maternal mortality, obesity and diabetes, injury and violence, sexually transmitted diseases, exposure to unclean air and environmental toxins. Not only do we lag significantly behind many other nations on all of these measures, but there are unacceptable disparities and health inequities between segments of our population in our own communities. Unacceptable. While it is very appropriate that we address health care access, health care quality, the costs of health care through health reform, the best health care system in the world would only contribute in a minor way to moving the dial the right direction for many of these population health indicators. We need to be clear about that. It is public health that has historically done the most to improve the health status of the population and is our greatest hope for the future. You have chosen a noble and great profession and career track, no question about it. Getting my master's degree in public health was a milestone in my career development. It did more than simply complement my medical training as a pediatrician. It helped me understand that healthcare is but one strategy among many that needs to be addressed in order to truly improve the health status of our entire community. It was like a big wake-up call. It's the environment, stupid. It's the bigger picture that needs to be involved, and that's what public health is all about. I fully expect that and hope that pursuing your MPH this will be an aha moment over the next 15 months or 2 years for you to understand that bigger context in which we all practice either clinical medicine or public health and see the bigger picture of what needs to be done broader in our communities in order to improve health perspectives. You are all pursuing an executive MPH degree, and I really applaud that. When beginning my master's degree program, I decided on pursuing a Master of Science in Public Health, which allowed me to avoid taking those health management courses, which was the track at the time, and to take more epidemiology and biostatistics. And although I very much enjoyed and got a lot out of additional biostatistics and epidemiology, while the department chairman gave me her approval to pursue this course, she warned me that I would rue the day, someday, that I didn't understand the management part and the practice part of what public health is all about. And sure enough, when I was appointed director of the Nebraska Department of Public Health in Nebraska, just out of clinical practice, I knew virtually nothing about leadership and management of a large organization, or in fact, in many ways, about the broader picture of how that organization fit into the larger initiatives. Fortunately for me, that very year, the Centers for Disease Control instituted its National Public Health Leadership Institute, and I was one of the charter members in the first year of that. It saved my life and was very helpful to me. But the point is, what I'm trying to say is that by your focusing on the executive components of what needs to be done out in the broader community of public health, I think you are going to shape yourselves to play very important roles in the broader public health community as you move into the broader public health enterprise. And you have chosen Drexel University and its School of Public Health for your academic pursuit. While I personally am not a graduate or a faculty member at the school, my interactions with faculty administration at the school there in Philadelphia and with the faculty and staff right here at the center, they have left me with a great impression of Drexel University and the school's commitment to excellence in education and commitment to strength in public health. I'm sure you will have an excellent experience here and be prepared as a result of your training here to play a major role in the larger public health enterprise. As you pursue your studies, I urge you to keep in mind some fundamental principles that are the foundation of public health, and I'm sure you're already beginning to be introduced to some of those principles. First, we have to remember that public health has its roots in compassion and social justice. We seek to ensure that every individual has the opportunity to lead a healthy life and to address the social and environmental factors that put certain individuals and populations at higher risk. Many of us believe that all of our energies and resources should be directed at addressing and eliminating health disparities and inequities among groups and segments of our population, and that the most effective way to do that is to focus on social and environmental determinants of health. Kind of a new direction and a new focus for public health moving forward. Not that we have to forget about one iota of what we've done up to this point, because it worked. Second, public health is based in and should stay based in science. Surely epidemiology and biostatistics remain, and hopefully always will remain, the core sciences that support everything we do. When we're in the broader public policy arena, sometimes decisions have to be made when science is not incontrovertible, and we use the precautionary principle in those cases to ensure that the public health is protected. But even in those cases, all decisions should be made using the best science available. That needs to be part of our characteristic. When people identifies as a public health person, it's that a person that goes back to the data and the information and bases decisions and initiatives on that. And that's what we stand for. There's a lot of reasons out there the decisions are made, religious reasons and cultural reasons. We have to be the ones that always stand up and say, but this is what the numbers show, and this is what we ought to do as a result of it. That's where we need to go. Third, public health is about fulfilling society's interest in assuring conditions in which all people can be healthy, said so well in the original Future of Public Health report back in 1989, I believe it was. This means that public health is truly everybody's job. All sectors of society need to be involved. This means that public health is about collaboration and partnerships in the broader community. Partnerships with healthcare, with education, with business, law enforcement, transportation, community planning and development, and all sectors of society. It's about health in all policies, helping every sector appreciate the role they play in contributing to the health of the population and engaging them in strategic initiatives to improve the health of their communities. And finally, public health is global. I never appreciated this more than ever before when I joined the Orange County Healthcare Agency and appreciated the impact of tuberculosis on that community. After learning and relearning some of the public health principles of control of tuberculosis in the community, I traveled to Vietnam, and that helped me understand that while we can control tuberculosis to some degree in Orange County, we will never fully address the issue until we understand the global threat that tuberculosis is and what threats there are in South Vietnam, in South Korea, and in China, and in those in India, and in the Latin American countries. Until we understand the dynamics of that disease globally, we will never be able to finally eradicate tuberculosis from Orange County. We need to be convinced of that and apply that principle to every aspect of public health. It applies to obesity, it applies to pneumonia, it applies to HIV/AIDS, so we need to keep that as a fundamental principle. And finally, just to talk about challenges going forward. No doubt in your training, you will choose a particular aspect of public health that has a particular interest for you. And surely there are major challenges that will have been there and sometimes forever and will remain into the future. And we're talking about specific challenges in maternal, child, and adolescent health, in chronic and communicable disease prevention, in environmental health, in healthcare quality. Public health has a major role to play in being the watchdog on the healthcare system, and finally in public health preparedness. But I wanted to alert you to a couple of challenges that are upon us right now, that it's opportune time for you to ensure that you are familiar with those and look for ways of contributing to addressing these issues forward. One of those issues I broadly describe as climate change and sustainable development. There are many public health folks that feel that even though it waxes and wanes from month to month almost in terms of its attention in the media, climate change and sustainable development are probably in many ways the biggest public health challenge in front of us right this moment. So we're talking about public health being involved in measures that are being considered to mitigate the human activities that accentuate global warming, and ensuring that those mitigations are consistent with good public health principles in our community, but then also being part of designing ways of adapting to what inevitably will occur, is already beginning to occur to us within our communities. And then in the broader issue of ensuring that we are committed to community development and sustainable development that most decreases the human impact on global change as we go forward. So I strongly encourage you in your studies somewhere to find an opportunity to learn more about that and ways that you can be engaged as a public health professional in addressing that. And the other couple challenges linked together, I think, is tremendously exciting, is the whole issue of health reform and health information technology reform. Health reform is upon us in many ways, but I think you're at a very opportune time in joining the public health community, because we are bumping up into major implementation of key components of health reform in 2014. You've got the advantage of a couple forward in this country. You're aware of some of the aspects of health reform that have huge impacts for public health. The fact that Medicare, private health insurance plans are now going to be required to provide a whole list of clinical preventive services to their clients, free of charge and without any copay. Public health needs to be involved in ensuring that healthcare systems systematically move forward in adopting those and look at how public health programs that are already in place and funded are modified and can be refocused as a result of those activities. And then, of course, as part of public health reform, there are major investments in public health, and we need to see what those are and what impact they can have, and what we as health professionals can play in ensuring they have the greatest impact in our communities. And then finally, I link that with health information exchange and health information technology. You know that we, as a result of the high-tech legislation, that everybody is on a fast track now to adopt the electronic medical record. This has huge implications for public health. Up to this point, we have still been relying on fairly, I call them antediluvian measures in some ways, about how we measure the health of our communities. Birth and death statistics and mandatory reportable diseases and surveys and registries, all very good tools. But I would submit that having robust interaction with the electronic health record and being able to extract data out of that will blow the roof off of anything we've known in the past in terms of our ability to truly monitor what's going on in our communities with regard to health. there are major challenges in ensuring that public health systems are adequately have the adequate infrastructure in order to appropriately interact with that. We need to be involved with that issue as a public health. All of us have a stake in ensuring that that happens right and to the best advantage of public health as a new way. So with those thoughts, I leave you once again with welcome. I'm very excited for you. All of us that have been around in this field, for every time we see a new class come on, we can put ourselves in your shoes and revisit the excitement that we felt when we started off on this new pursuit in our careers. I wish you well. I wish you the same excitement that I have felt throughout my career and the great success that public health will lead in shaping your careers moving forward. So have a wonderful day and have a wonderful experience here at Drexel. Thanks.
Okay, I'm going to ask all the students to line up on the right wall over here in alphabetical order, if you could. And we'll call your name up and you'll receive a pin from me.
Either way, sorry, no worries.
Okay, so you're going to have a nice picture of yourself taken as you come up. Be aware of that as you come up. So I'm going to call your names, and as I do, please come up and take your names. Jahan Aharari. Aaron Brinko. Jennifer Buser. Rosalinda Serna. Diana Hernando Benton. Angela Justice. Marvin Mardusan. Joanne Morales. Lashna Pandya. Carol Stanford. Michelle Wu.
Our commitment to this goal is made with full awareness of the difficulty and complexity of the challenge which lies before us. For we in public health know that society is the major determinant of health space. Because human well-being, physical, mental, social, depends so much on societal factors, we must work towards societal transformation. This commitment to social justice is guided by our respect for human rights and dignity. We are strengthened by solidarity with those who suffer, with those who seek in many different ways to prevent and alleviate suffering, and with each other. Together, let us quote from the preamble to the Universal Declaration of Human Rights, the core document of the modern human rights movement. Please rise.
Recognition of the inherent dignity and of the equal and inalienable rights of all members of the human family is the foundation of freedom, justice, and peace in the world. The peoples of the United Nations have reaffirmed their faith in fundamental human rights, in the dignity and worth of the human person, and in the equal rights of men and women. And from the Charter of the World Health Organization, the highest attainable standard of health is the right of every human being. This forms the basis of our concern with health, human rights, and dignity, and therefore to public health. Today we mark and celebrate the